look at that. The data sets used for tracking the data and making the visualizations, the webpage will no longer be updated. If they were still encouraging reporting, why would they stop updating? That's suspicious. Probably start this walk down memory lane back in December of 2021 when Delta Airlines CEO Carlos Del Rio sent Rochelle Walensky, the director of the CDC, a letter asking the CDC to change its isolation guidelines down from 10 days to a proposed 5-day isolation. Rochelle Walensky granted him that wish. This, of course, was going on the exact same time that the United States was now facing the newly emerging Omicron variant. See, as of December 4th, 2021, Delta was still taking up 99.9% of the circulating SARS-CoV-2 variants in the US. The CDC went ahead and told us all that COVID was mild, and they cited a study. Here's the study. The National Institute for Communicable Diseases frequently asked questions for B.1.1.529 mutated SARS-CoV-2 lineage in South Africa, Johannesburg, South Africa, National Institute for Communicable Diseases 2021, and that had been published on the 26th of November 2021. Literally only a few short weeks since it was first identified. Now, unfortunately, nowhere in the article does it actually say that it is mild. It simply states that there's no unusual symptoms that have been reported following the infection with that variant. And at the time that they wrote this article, they said that they were actually establishing a real-time system to monitor the hospitalizations and outcomes associated with that variant, Omicron. Further, the study finds no evidence of Omicron having lower severity than Delta. So the CDC cited that source incorrectly and made claims that were untrue. This is certainly problematic when we see that Omicron largely evades immunity, not build it, from past infection or to vaccine doses. About a month later, the New York Times reported that the discovery that vaccinated people could spread the Delta variant through President Biden's vaccine-centric strategy off course. It was a heart-sink moment, Dr. Rochelle Walensky recalled. So when Biden's administration realized that the vaccine-only strategy was not going to work, it wouldn't suffice, and with the oligarchy Delta Airlines letting the CDC know that the economy needs saving, the methodical dismantling of data acquisition trudged on. Of course, by that point, they had already told everybody just to vax and relax, and then probably take some Paxlovid. They couldn't just tell people they needed to mask back up again. That would look really bad politically. In order to convince the general public that the administration was strong in handling it, Operation How to Hide a Pandemic commenced at full speed. See, we'd already started hiding some of the data because you gotta keep that economy going by getting them kids back to school. Regarding the data, back in August of 2021, Massachusetts as well as several other states stopped reporting child hospitalization data. Why? Well, the kiddies were getting ready to go back to school defenseless. Certainly peculiar, but let's move on. In this New York Times February 20th, 2022 article, it tells us that the CDC isn't publishing large portions of the COVID data it collects. The agency has withheld critical data on boosters, hospitalizations, and until recently, wastewater analysis. For more than a year, the Centers for Disease Control and Prevention has collected data on hospitalizations for COVID-19 in the U.S. and has broken it down by age, race, and vaccine status, but it has not made most of that information public. And as that same article pointed out, that the CDC is a political organization as much as a public health organization. Later that month, the CDC published a new map. Rather than community transmission, they referred to it as the community risk map. You see, in the old map, even what was considered high transmission was now considered low. In a post on June 19, 2022, I stated, I mean, for fuck's sake, look at what the CDC has done to the map. If you aren't aware, community transmission versus new community risk maps. These are reflecting the exact same time in recent history and published at the same time. What's pushed out is the photo on the left, so people think they're okay. And if you zoom in, you can see that they've removed all alarming neon colors like red, completely shifted the scale. In March of 2022, in the New Hampshire Bulletin, it was published that the state and hospitals don't see eye to eye on counting COVID hospitalizations. In an announcement Tuesday, the Department of Health and Human Services said it had redefined COVID-19 hospitalization to include only patients being treated with remdesivir or dexamethasone for hospitalized patients with moderate to severe illness. The change is part of a national trend and one backed by the Biden administration in February of 2022. Of course, by May of 2023, administration added a new map. U.S. percentage of provisional deaths due to COVID-19 in the past week by state or territory. With not just one or two, but 3 shades of pastel green and maybe an orange creamsicle when it gets real bad. Now, as a reminder, when looking at this map, looking at high amount of COVID mortality rates would mean more than 8% of the deaths that occurred that week were from COVID. However, the scale that they are using is the equivalence of manipulating the y-axis on a graph via scale expansion, which skews the data to appear less significant. Additionally, it's problematic when the NCHS data lags and is provisional, so this visualization is designed to misconstrue deaths, skewing low and incorrect. Around that same time, the CDC announced that hospitals no longer had to report some of their COVID data, like cases that were originating in the hospital. So even if the patient was on remdesivir or dexamethasone, if it originated in the hospital due to the lack of PPE, it wasn't counted as a hospitalization. If that weren't bad enough, by June of 2023, the hospitals were no longer required to report suspected COVID cases. March 31st of this year, 2024, Michael Olson shows us that this is the weekly U.S. COVID admissions. These dotted lines that drop in June last year is due to the requirement for reporting suspected admissions. So after that time, this data is only representing about 1/3 of the actual numbers. So in May, when they officially cut off the hospitalization data, even those hospitalizations were only reflecting patients that were treated with remdesivir and dexamethasone, that did not acquire the infection in the hospital, that did not include pediatric hospitalizations or suspected cases of COVID. But we are gaining immunity. Unfortunately, the administration had been so effective at communicating that it was mild that only 17% of the population, understandingly, decided to get an updated COVID vaccine. Why would we get vaccinated against something so mild? And despite how immune-evasive any of these emerging variants are, no other name has officially been given to any of these variants. They are all Omicron. Though scientists have tried to rebel by naming things like Kraken or Pyrola, or naming the mutations like Flip, Flirt, or Fluke. But we are gaining immunity. Geez, we should tell that to Brazil, who's in a state of emergency right now, or in Spain, where COVID hospitalizations have quadrupled in the last 2 weeks. Reminder, reinfections cause cumulative damage and increase the risk for long COVID developing. That's the opposite of immunity.